I'm David Payton, chiropractor. I'm here with Dr. Don Murphy. We're at the Rhode Island Spine Center, and this is an informal introduction to Dr. Murphy. And I'm here just on a vacation and business trip along the East Coast. And just to get us started, for the South Africans who'll be watching this, I'd like the cameraman to pan around and have a look at the snow outside. That's for the patient's mountaineering over to just to add a little bit of extra spine problems to the mix. So Dr. Murphy, thanks for having us.
Thanks for being here.
Yeah, thank you for welcoming us to your practice.
Yeah.
You just give us a little bird's eye view and a run through of this place.
Yep, so this place is the primary spine care facility that's part of a integrated spine care pathway that is run by me and under the auspices of Care New England, which is the company that owns this, as well as several other different medical providers and systems. And so the system here is the primary spine care practice. And again, this is part of a larger spine care program that I'm running. So patients who come here, this is an outpatient facility, and when patients come here, they receive primary spine care practitioner services, and that means that the majority are managed without the need for referral, depending on what the problem is, but also the primary spine practitioner is in charge of determining whether the patient needs to be to see other practitioners for other services such as behavioral health or psychology, surgery, injections, imaging, further diagnostic investigation, depending on the situation of each individual. So it's part of the pathway that determines the most efficient and effective way to manage the patient.
Right. Okay. So this is your personal private practice that how long have you been in this practice for?
This was my private practice. I was in this facility for, I believe it was 16 or 17 years. Before that, I had practiced in other facilities. I moved here, and I think it was in 2001. Okay. And I practiced primary spine care in my private practice for close to 30 years. And so finally, Care New England saw the value of the spine care pathway for many reasons that perhaps we can get into. And so they brought me on to implement the pathway into Care New England and develop a prestigious and high quality spine care program.
Wonderful. Well, that's an introduction. I'd like you to just take us around your facilities to have a look and talk us through how the flow works for patients.
Okay, so we have individual rooms that patients can be seen as new patients or for treatment or exercise or education, depending on what the patient needs on any given visit. So they may come into a room, and for example, we have a table here. This is where I do my primary new patient exams. And so I'll take my history, do my exam, to have a discussion with the patient, educate them as to what's going on and what my recommendations are with regard to what's the best way to help her overcome this problem as quickly as possible.
You can see someone's credentials are advanced when the coloration of the white starts going yellow, so we know that you're well established.
Yeah. And someday I'll straighten those all out when I don't get too busy and I have time. I'll straighten those out so they won't be so crooked.
Where was your education done?
I had my DC training at New York Chiropractic College and graduated in 1988. If anybody can remember that year, that was actually a year that existed.
I was two, and the cameraman was not even born.
Yeah, yeah. So and then I've done postgraduate education, multiple places and topics and etc.
Great, excellent.
Yeah.
Okay, so this is room 1.
Yep. And so then we have treatment rooms where patients can be seen and receive primary spine care, and that can be hands-on services that can be exercises, most of which can be done on a simple mat. That may be simply educating the patient, guiding them to do what they need to do for themselves to overcome the problem as quickly as possible. So whatever the patient needs and whatever is best geared toward helping that patient improve as quickly as possible is what we do here. And so it depends on each individual patient and each individual visit, what they need and where they are on the continuum from having a spine disorder to no longer having a spine disorder and being independent of the need for seeing doctors and practitioners, etc.
Well, one of the key differences that I'm noting that is coming out frequently here is a complaint that I've received from patients and that are picked up in the community. Many patients will tend to complain about practitioners that they've come from who have just done a stock standard, you arrive, you get a couple of clicks and you go.
Mm-hmm.
And what you're indicating here is there's a uniquely tailored approach that is obviously evidence-based and patient-centered in the sense that you're empowering the patient to overcome their ailment in the fastest time possible.
Mm-hmm. Yes, so that's a big, important part of our approach and why we have an integrated pathway. Because this is a complaint about a lot of practitioners, not just chiropractors, but practitioners in other fields, where basically patients go to see the practitioner, and the practitioner just does to the patient what it is that's most important to them. Mm-hmm. So it's a patient. It's not patient-centric, it's practitioner-centric rather than being patient-centric. So when you come to me as a practitioner, I just do whatever I feel is best for me or what I'm trained to do, rather than evaluating the patient and saying, okay, what does the patient need? Determine what the patient needs. How much of what the patient needs are things that I can provide? How much of what they need are things that other practitioners that I'm affiliated with or connected with can provide, and do what's best for the patient.
And all of that based on what the evidence suggests is the most appropriate.
Correct.
Right.
Exactly.
Wonderful. So just for clarification, these two rooms, will you be going back and forth between the rooms, or will there be clinicians that will be operating these rooms specifically?
Well, I'll have my patients in rooms. There are other practitioners here that will be also seeing patients, and I'll have a patient there. I'll have a patient here, and it's a busy place.
Okay.
But we're very efficient, and we give the patients the care that they need, and patients are very satisfied.
Yeah.
But it's very busy, so new patients, I can spend anywhere from 20 minutes to an hour with them in the new patient facility, but the new patient visit. But on follow-up visits, usually it can be 10 minutes, it can be 20 minutes, depending on the individual.
Right.
And we organize the schedule.
Now, will you spend with a new patient visit? Will you spend that entire time with the patient in the room? Will they be handed on to get modalities done or soft tissue therapy or?
Generally, the primary spine practitioner provides most or all of what the patient needs. We have physical therapy here. We have practitioners that utilize acupuncture, depending on what the patient needs. And so it depends on what the individual patient requires. And we also have here we have interns and residents who take some of the history and do some of the examination procedures that makes our job more efficient and our schedule more manageable.
Excellent. Room 3.
Okay, so with the follow-up rooms, they're basically the same. It's a space that allows the primary spine practitioner to provide the patient with what he or she needs. And you mentioned the word modalities before, and you'll notice if you look in the room that there aren't any electrical modalities. Why? Because the evidence suggests that electrical modality is not helpful. And so we are geared here toward providing the patient with what they need to move as quickly as possible from, again, the place of having a spine-related problem to having gotten over the spine-related problem, and as quickly as possible getting there. And what we found out, as it turned out, the evidence is that electrical modalities are not very useful. However, there are manual treatments that are useful, exercise, education, teaching the patient how to take care of themselves being the focus, and that's where we place our focus. As a result, our efficiency is high, and we don't need a whole lot of space because it's about really being focused on what's best for the patient.